I would like you to help me in welcoming Mr. Ivan Murenzi, the Director General of the National Institute of Statistics, Rwanda, as he comes to the stage.
Good morning. It's a pleasure this morning for the National Institute of Statistics of Rwanda to host you all, distinguished guests, honorable ministers, to this event where we are launching the key findings from the Demographic and Health Survey, the 7th actually. And this morning, I want to be able to cover some of the key indicators, but I will say we have more information that will be coming in the near future. What we do is we release what's called a key indicator report. And thereafter after some few months, because of the survey that we collect some samples, we do more tests working with the partners in the health sector, and we release a detailed report with more information. So for this morning, this is the outline I have come up with, where I just want to give a bit of the survey background, and thereafter talk about some key indicators as outlined there. Talk about fertility, talk about family planning, talk about teenage pregnancy, maternal care, child and maternal mortality, vaccination, child health and nutrition, and then HIV. And the background is, as we all know, is that DHS has been done over several rounds. We started in Rwanda in 1992. That's when the first demographic health survey was conducted. And then we had a gap of continuity in doing the survey. But from 2000 and today till now, we have consistently been conducting a survey. Now, that's very commendable in terms of continuity. We have 6 series now, 2000, 2005, 10, 15, 20, and now 2025. That's a huge amount of information in terms of continuity, same method, same key indicators, in giving us a holistic picture of the health sector. As we know, the survey is aimed at providing demographic and health indicators in summary, and we have all indicators at national level, at urban, rural, provincial level, and for some few indicators at district level. Not all indicators is possible to have them at district level. But when you have the picture at provincial level, and here we have the mayor, Kigali City, and the governors from provinces, which we welcome that you are here, you have then a picture which you can bring together district authorities, and we work with you to do that, where we go into details, show the pictures at provincial level of all the key indicators, and have the leadership from districts engage with this information. So, going to the key indicators, the first key indicator I want to bring up is on fertility. Fertility is so important, to track fertility. What we see here on the left is that over the number of DHSs we have had, fertility has been decreasing. As of now, fertility is at 3.7 children per childbearing woman in Rwanda. That's the average. That's to say, some women in this phase of childbearing might have more than 3, might have 4, 5, but some might also have 1 or 2. So the average comes to about 3.7. Fertility matters. Fertility matters because in the immediate, it's very important for the health sector to plan on how to give the right interventions for children, for mothers giving birth. So that's very important. On the education side as well, it matters because it gives a picture of the needs in terms of children that are going to have to be educated. Now, there's always a debate on the right number of children. I won't engage in that debate, but what I can say is that as long as a country has the means to sustain the fertility that it has, that's what matters. Us looking at this fertility is to think through what that means, and the leadership is already engaging on that. When we look at fertility of provinces, you can observe that, yes, there's a general decrease across all provinces. Some province, like Eastern Province, still on the higher side, but also a significant change in Western Province from 4.5 to 3.9. But generally, across all provinces, we see that fertility has decreased, which is consistent with the national level. Now, in thinking through what could explain the decrease in fertility, one way to look at it is to think of what are the fertility preferences for women. And this pie chart here looks at 47% who want no more children or sterilize or really fully stopped giving birth. And then you have some who are declared infant, and then you have some undecided 2%, but then you have the other two sides, 37 and 13%. 37 will have another child maybe after 2 years, and then 13 will have another soon. So those are the two portions. 13 plus 37 is what gives us 50. Is what gives us 50% of women in this childbearing age planning to have a child. So that's to say, where do we stand with people's plans about children? That's where it stands. But fertility preferences is not sufficient to maybe explain the levels of fertility you see. The other thing to think about, more importantly, is family planning, actually. And what we see with family planning is that you start with a demand. What percentage of women want family planning? And the figure here, 78% is the total demand. That says that 22% are not in need of family planning because they want to give birth, so they don't need to use family planning. But now, these ones who you want to use family planning, what options do they have? The first main option is modern methods of family planning, then traditional methods, and then there's this 9 who have not had the options. So the 9 implies that they would want to have family planning, but probably the option they want is not met. That's what we call as unmet need. Now, again, 78 is the demand. They would want family planning, and they use these options, mainly modern methods. The 22 is those who want to give birth, so they don't need family planning. Now let's look at the trend. On this side here, what you see is that generally the use of modern methods has been growing. That has to do with access, that has to do with education, and the unmet need has been declining. So that's a very commendable progress to the health sector in terms of family planning access. But there's still a proportion of unmet need. And maybe we'll look at it and say, who could they be? Could they be the young women? Could they be... That's something we can discuss. And the use of traditional methods is consistent also. It's a preferred method as well. I think there's more to digest. The experts in health sector can engage this and actually take out more nuances in terms of what this means. But family planning, as I said, could be a key factor in explaining fertility as family planning is accessed. Now, when we think of family planning, here I was referring to women in marital union. I should highlight what this means. Marital union means those women who are married or living together with a partner. Marital union is all about people living together, either married officially or not married officially. this is a key segment to ask ourselves if they have access to family planning, because there is a more high likelihood for conception. However, on the next slide, we say, okay, moving on from these who are in marital union, how about a comparison of those who are in marital union, but as well as those who are sexually active? They are not in marital union. And this is very interesting to think about. So first of all, we put this pie chart to say, what's the proportions? The proportion is that women in marital union are about 50% of the age of this segment, 15 to 49. 52% are in marital union, and then 45% are not in marital union, mainly teenagers, mainly those 15 to 19 or 20 or 22. So that's why it's a big number. But then you have a 3% who are sexually active not in marital union. So pay attention to this number. 3% not in marital union, but also sexually active. And what we mean by sexually active is anyone who might have had sexual intercourse in the last 30 days of the survey. And I just skipped some things around our methodology because I didn't want to engage you in so many technical things. But what I can say is that DHS is one of those unique surveys where we use experts, we use nurses, health professionals in collecting data. When we are discussing these matters, these are women talking to women. And these are protocols we follow. And so we are very grateful to the Minister of Health, RBC, for facilitating this endeavor. When it comes to DHS, we always engage them to give us the right people who are professionals who know how to ask these questions, and also they have to know how to take the samples. So I just pause to say this information is possible for you to arrive at it, to get this information, depending on the people asking. Now, so down here we say women in marital union and sexually active. The expectation would be that if you are sexually active and not in marital union, are you using family planning? Are you doing family control? And the answer is that only 54% sexually active were using any method of birth control. And so you have those using modern as 52 and traditional as 2. I had already shown you the ones in marital union, how that looks like, because this is the 64 and the other. Now, a clear breakdown of modern methods. Modern methods are varying. There are so many methods. Again, I'm not the expert here to explain them, but what you can see is that we have injectables, we have implants, we have the pill, we have the condom, we have other detailed methods, all aggregated. This is the picture. So the observation is that for women in marital union, meaning married officially or living together, they use all these different methods of modern methods. But what's interesting is when it comes to those who are sexually active, you have them using also the various options. When it comes to condoms, they're the ones who use mainly condoms. But again, when it comes to percentage, 54, my observation was that if someone is sexually active and not married, ideally you want them all to do some family planning. So the message here is that this number should be higher, this percentage. 54% sexually active, more should be using actually family planning. Now, moving on, teenage pregnancy. Now, this is a subject which has in the past been a focus of attention, and DHS takes keen interest to track teenage pregnancies. And when we say teenagers, we mean those 15 to 19. Some might say, but by definition, we thought a teenager would also include 13. And I will explain that. When we ask those who are 15, we are asking them in the last 3 years if you have had a child. And so, indirectly, we are implying if they might have had a child even when they are 13 or 12. So I hope that clarifies it. Now, this is the picture. What we observe is that teenage pregnancies have increased from 5% to 8%. And it's very important, though, to break down this and say, where is the main concentration? The main concentration is those who are 18 or 19. The understanding here is that we are saying those who are 19, those young ladies who are 19, the question is, had you had a child? You could have had a child when you are 16. We are asking you at 19. So that's why the likelihood goes higher. That's why the likelihood goes higher. The interpretation is not, you shouldn't interpret this to say those who are 19, at 19, they had children. No, no. Here we are saying, here we are saying by 19, you could have had a child. And so you could have had a child, so the likelihood increases as you move on. Could this be a bit of a connection to the earlier slide we saw where we're saying sexually active, use of family planning a bit lower? Probably, but this is not so simplistic in terms of why teenage pregnancies could be high. This is one of those areas where more understanding can happen because there are so many factors, socio-economic factors that can contribute to activity, the awareness, and all the other. Now, clearly, the likelihood for a teenager to have to be pregnant goes higher with the levels of education, and we can see that, especially those with no education or primary or secondary. I've made an observation here that the sample is not sufficient in terms of university. And when the sample is not sufficient, we prefer not to really put a figure. But the takeaway is that education is a factor. Now, moving on to another key dimension. When we talk of DHS, maternal care is a foundation. Maternal care is a foundation of so many things. And what we observe is that maternal care has continued to improve in Rwanda. What we have on this side is deliveries in health facility. We have 98% of all deliveries happening in the health facility. I think this is a commendable progress. And deliveries assisted by a skilled provider. A skilled provider includes a doctor, a nurse, a midwife at 98%. And the graph here shows the trend. The trend continues to increase. We were at some point, not so many years ago, around 30s. So 20 years from this period, we are at 98. I think that's a commendable progress. I think it deserves a hand clap for sure. Because it lays a foundation. When maternal care is happening, then the other things gradually keep getting better. And indeed we see that. So here we break down and say percentage of birth in the 2 years before the survey assisted by a skilled provider. And we look at some key dimensions that the health sector pays attention to. One is received antenatal care from a skilled provider. The other one is at least 4 visits for antenatal care. I understand now the ambition has actually gone to 8. But going by international standards, 4 is already good, but Rwanda is aspiring for even much higher. Received postnatal care during the first 2 days after birth. Now, this goes a little lower. The understanding here is that for maybe mothers who give birth well, maybe within a day or 2 and leave the hospital, the likelihood to come back goes a little down. Again, I'm not the expert here. This is for health experts to digest and see what this means. And when it comes to trends, this is for me where I focus my attention. The desire is that care keeps being accessed. And we were at some point from 10, 13, 36. This jump here to 78 is what we can pay attention. that reflects some significant effort that has happened. Then, with maternal care happening, the question is, what's the impact? And that impact can be looked at when we talk of child mortality and maternal mortality. So here, I want you to all focus and read on the side. I won't read those illustrations, but they help you understand the dimensions we are talking about here. When we say neonatal, postnatal, infant, under child mortality, under 5 mortality. These are different breakdowns, and the explanations are here. Now, what we see is that this is the picture as of DHS 2025, where under 5, if I start from here, 36 children per 1,000 live birth. This is how we look at this indicator. 36 per 1,000 live birth. When we talk of infant mortality, 27 per 1,000 childbirth. Now, infant is an addition of these two, neonatal and postnatal, whereas under 5 is infant and child mortality. I hope this is meaningful. I hope this becomes clear to everyone. Theophile seems also to understand it, so that's good. Now, when we come to the trends, so that was a snapshot of 2025, but now let's look at the trends. On this side here, the top part is under 5 mortality. It's been decreasing over the years. When you start to go low, the trend of decrease reduces. You have to have some extra efforts for you to reduce further. And we see that we've moved from 45 to 36. For sure, that's a decrease. And for infant, we have decreased from 33 to 27, neonatal from 19 to 17. When we refer to the NST, the targets are much ambitious. The targets are much ambitious in terms of these indicators. 36 children per 1,000 live birth. I want to make an observation that the decrease is important to take note of and shows the efforts that are happening, but these dimensions, for them to decrease further with this low level where we are at, it takes more effort, Minister. It takes more effort with where you want to go next. And some of it might not happen in 5 years. It takes some while to have another significant jump to another level. So we should not beat down on ourselves. We are in the right trend. But again, it calls us to, as a whole, not only the health sector, it's a combination of so many things. When you aim to go much lower, it might take some time, and there's a collective effort that has to happen for you to get there. But at least this is what it is. Now, with the maternal mortality, also we see a decrease to 149 per 100,000 live birth, per 100,000 live death of women per 100,000 live birth. It's at 149. If we do the comparison of Rwanda and other countries in the same income category, Rwanda is much better in terms of income when you compare countries in the same income categories. But Rwanda's ambition when it comes to the health sector are not necessarily based on that, and maybe Minister will speak to that. Anyhow, the takeaway, we are moving in the right direction. When you go down, the decrease starts to be a bit small. Another key aspect that as well connects with well-being of children is vaccination. And vaccination has some international basic vaccines that we look at, as well as the national vaccination schedule. Minister, I hope I have fairly represented this in terms of what it is. So in DHS, we are looking at the follow-through of at least the basic, we call it the basic, and the national schedule. And so we are looking at the numbers of children, the percentages of children who have achieved the basic as well as the the national schedule. What does that look like? And here we're talking of children aged 12 to 23 months, considered fully vaccinated with both for basic and as well as the national schedule. And what do the numbers look like? When you look at those aspects, we have all components of basic, those who have done, it's at 94%, okay? Meaning children 12 to 23 months who have had vaccinations of all the components in the basic, 94%. The division is not so different between urban and rural. But when you go to the components of the national, which are more, as you saw, you have about 4 extra vaccinations that the national schedule requires. In that case, the percentage goes a little lower. The percentage goes a little lower. I think the aim here for the health sector is, again, for this maybe to be in the 90s, maybe full percentage coverage. So yes, there's some way. There's some way to go. And so you would say there's a bit of reduction from 96 to 94. In this case, in this DHS, I will observe that working with the Ministry of Health, we were trying to see the evidence. We are not just asking if women were declaring that their children had been vaccinated, because there is evidence that they have to show. And so what we observed is that obviously in some cases it was challenging for some women to have the evidence for us to verify. So I really want to acknowledge that and say, could that also be a factor, Minister? It's something we'll explore further. Could it be in terms of recall with the evidence? Because this is something we had agreed with the ministry, that maybe the number goes a little down. But at the end of the day, it's not an indication of any failure per se, given the levels we have here at hand. So this is the other key aspect of DHS, which I want to cover quickly, in terms of nutrition. A couple of indicators here. One is stunting, low height for, again, we put some explainers there. We have stunting, we have wasted, we have underweight. What we see here, I have quickly brought out the trend, is that again we have been going down, now at 27% of stunting, whereas wasting at underweight at 6% and wasting at 1%. This kind of goes to the earlier point I raised. There are some phenomena when we are talking of stunting, when we are talking of underweight or wasted, which for you to begin going more lower, it's a number of interventions that have to be at interplay. 2, this is a phenomenon also which takes a while. Interventions of this year and last year, and probably even the other year, will be felt after a while. So some of these phenomena, they take a while for you to feel the impact or the effect of what has happened. And then we also have a track of overweight, which is at about 5%. But again, the experts will engage further in the report. We'll put more details for people to think through. The takeaway, the trend is going down in terms of the interventions. Maybe not so much at the rate we have aimed for, given the targets in the NST, but the direction is right, Minister, and other partners here. What we can see, this is a picture. I like pictures. I like these maps because for me they simplify the summary of the message. In DHS 2020, you had about 20 districts with a prevalence of stunting higher than 30%. DHS, the last DHS. About 20 districts had stunting levels, and this is important for the governors as well. And with this DHS, that number is 11. So you see the red has decreased. But there are still some red and orange, and that calls for attention. So this is an image to keep in mind. and we'll provide details. When we have discussions, I look forward to the governors and the mayor organizing these discussions, which we have at district level, where we go through these details, because it's important from that level for people to understand. So that's the picture. And the last part I will bring out quickly is HIV. HIV, we focus in DHS, we focus on awareness, and awareness is a key factor. And there are some basic questions. These are questions used internationally, and these questions are more targeted, Honorable Ministers, to those who are 15 to 24, because awareness matters at that age. And there are myths here, as you can read, and there are facts. And so we ask these questions to this age group, and we want to see how comprehensive they are aware of this. If someone is fully aware, that shows full awareness, because these are not complicated things. But if they lack some awareness, then they don't have the awareness. That's how it is measured. And with that, what you have is that when it comes to that age group, 15 to 24, you find that awareness is at 57 for women, 53 for male, and these are the levels by urban and rural, slightly higher level compared to rural areas. What you can observe, though, is that awareness has gone down when it comes to HIV. We have come from these levels a little bit to going down to 53. Again, I'm not sure, I'm not the expert. Is this the desirable level? It's a question to all of us here. What kind of awareness do we want? Do we want 90? Do we want 100? But I would assume awareness matters, that people should be aware, and therefore more prevention. Now, in the full DHS, there will be more details on HIV. I think with that, I come to the end, actually. And with the end, Honorable Ministers, I wanted to take a moment to acknowledge, as DJ NISR, that this DHS was an outcome of concerted effort by various partners. I will say that several countries were not able to do DHS, as you are aware, as some of you might be aware. Globally, DHS has been supported by USAID. We acknowledge the support we've had with USAID over the years, but unfortunately, this round, the USAID and the government of USA was not able to come through. So we were at a standstill. I almost called DHS off. And I engaged the Minister of Finance and the Minister Minisante, and they assured me and said, we can still go ahead. And how are we able to go ahead is because of you partners. I want to acknowledge the World Bank, who have been funding us for statistics for a while, the UN system, the other partners, all represented here. It was an amazing moment. I recall the meeting we had with Minister Sabe at NISR, and I looked in the faces of the heads of institution and I said, you can't live without committee. And I want to appreciate that. A handicap to you. So here we are, we have been able to finish DHS, and I want to thank you all. Thank you again.
Thank you so much, Director General, for that very insightful and a comprehensive presentation. Please, let's appreciate him with another round of applause. As he briefly highlighted when he started, this particular survey is released periodically after every 5 years. And the kickoff for the preparation for the RDHS7 actually started back in June 2023. And we had the main survey operations, including training, data collection, data processing as well, happening this year between May and November. As you can see, a lot of effort has really been put into this. And from what we saw from the presentation by Mr. Ivan Murenzi, these are not just numbers that we get to see in the report or here on the screen as it was reflected, but this is a mirror of the lived realities of Rwandan communities, Rwandan families, children, women, and it really gives us a picture of where we are going and a call to action to each and every one of us putting our heads together to make sure that we actually continue transforming the livelihoods of Rwandans. And as we continue reflecting on these findings, it is now important to hear how this evidence informs policy direction as well as national planning. We're now very delighted and honored to invite to the stage the Honorable Minister of Finance and Economic Planning, Honorable Murangwa Yusuf, to come and deliver his remarks. Let's appreciate him with a round of applause as he comes.
First of all, I've requested for this slide to come back because I think it's very important, extremely important. Director General NISR and your team, the whole team from the National Statistics Office, I want to thank you very much for a very good job. The quality of the work is outstanding. Thank you very much. Honorable ministers present here, the UN resident coordinator, and my very good friend, thank you for making it. Again, the Director General NISR, all development partners that have made it here, government officials, NISR staff, civil society, academia, all protocols observed. I want to thank you for joining us today as NISR presents the results of the 7th Rwanda Demographic and Health Survey. The Demographic and Health Survey remains one of our country's most reliable sources of evidence for understanding population dynamics, health outcomes, and overall social well-being. It is not usual to have consistent statistics on a very important aspect for over 30 years. And the Demographic and Health Survey gives us that opportunity. Its findings guide our medium and long-term development plans. In this way, the Demographic and Health Survey helps ensure that our national policies are aligned with the real needs of our population. The findings of the Demographic and Health Survey indicate quite good progress in many demographic and health areas, as has been indicated by the Director General of the National Institute of Statistics of Rwanda. We've seen stunting reducing. We've seen maternal mortality reducing. We saw that under 5 mortality and all related indicators improving. We've seen access to health services improving. This progress aligns with Rwanda's commitments under the second national strategy for transformation, NST2, that we've committed to enhance the quality of health and strengthening our health systems. But despite these gains, some indicators like immunization, It was a little bit explained, but we see some decline in immunization. Worryingly, we see knowledge and awareness about HIV reducing. We see teenage pregnancy increasing among other indicators that we, if we get into the details, are not making the progress that we want to see. And this calls for renewed focus in terms of our interventions. These findings will help us refine our national priorities and ensure that resources are targeted and reach underserved populations, especially with equity across all regions. We will continue to emphasize very strong coordination across all sectors to get good results in health and demography. We need quite good coordination to see the results that we want to see that are targeted, and also increased efficiency in spending, especially at this moment. I call upon all multi-sectoral stakeholders to use these results to inform their programs and guide the investments that we put in health. Overall, we, the government of Rwanda, working with our partners, need to increase investments to sustain and accelerate these improvements. These results reflect realities of our people, and they mark the starting point for renewed action. I invite all of us to use this evidence to build a healthier, more prosperous, and a more resilient Rwanda. As I conclude, I want again to thank the National Statistics Office and all our partners who contributed in terms of resources and technically, especially those that are displayed above here. We did a major shift in the way we collaborate on the demographic and health survey. The first major shift was with the UN system around 2010. Before that, the demographic and health survey was mainly a government of Rwanda project with support from the US government. Starting from 2010, we made a major shift where the UN came on board strongly to collaborate with us. At that time, specifically UNICEF and UNFPA, but that has expanded over time. Then other partners started coming on board, the World Bank through a very big program that we have with the World Bank, but also other partners, big and small, all of them are equally acknowledged. So I want to thank you very much, especially we were at a very big risk of not doing this very important project. So I want to thank you again, and thank you for being with us on this day. Thank you very much.
Thank you. Thank you so much, Honorable Minister, for those very insightful and forward-looking remarks. I think Honorable Minister's intervention has really emphasized how crucial this is, but also demonstrated clearly how data and policy must move together if we are to sustain Rwanda's development gains. We're now going to hear from the UN Resident Coordinator, Mr. Ozonia Ojielo. Please, you're welcome. Let's welcome him to the stage.
Honorable Ministers present, DG, NISR, and all the staff of NISR, all the various distinguished government officials across all levels of government, my dear colleagues from our Cooperation Partners Group, my dear colleagues from the United Nations system, our various partners, civil society, good morning. I join the Honorable Minister and on behalf of the UN system and the Cooperation Partners Group to extend our congratulations to NISR. Excellent job, really, excellent presentation. So clearly, we also acknowledge the leadership of the government of Rwanda in making this happen, given the context that the DG and the minister have established about the risk that this could not have been organized because of the withdrawal of a major participant. But clearly, what the DG has presented shows a tremendous effort that went into conducting the DHS7, despite the challenges. And as the DG mentioned, many countries were unable to conduct their own DHS because of the withdrawal of a significant partner. So clearly, I want to extend our congratulations and appreciation to all my colleagues in the Cooperation Partners Group, but to all the other partners, including our civil society partners, who supported the implementation of this survey. As the Minister highlighted, it was clearly wonderful to see the extensive list of partners that came together to ensure that the work was carried out successfully. So what we are celebrating today is Rwanda's commitment to accountability and evidence-based policymaking. So clearly, all of us should be proud to be part of this moment in history, particularly for the successful results, the trends that we see, that all the indicators, particularly those are challenging for health, the development of the society, are on the decrease. And as the DG highlighted, it does then require an extra effort to go the extra mile. And that's actually the most difficult in terms of development contexts. So the DHS remains one of the most trusted and comprehensive sources of data on health, population, and social development. It's clearly a cornerstone for monitoring national development plans, the SDGs, and global health commitments. The survey also has revealed the disparities between urban and rural areas, between rich and poor households, and between men and women. This is helping us to understand who is at risk of being left behind, and therefore how we should mobilize and redirect our collective efforts. But looking broadly at the results that have been presented, it's very encouraging in terms of the progress that has been established in several areas, including improvements in child survival, continued strengthening of maternal health services, declining fertility rates, as well as other notable indicators. These achievements are worthy of celebration, and they do reflect the dedication of the frontline health workers, community health workers, government leadership, and sustained support from partners. So let me also congratulate the Minister of Health and all the staff in the ministry, how the work across the districts, for the really outstanding work that's done. We do know that a few indicators are challenges, but they're clear signposts. But what we do see is a clear commitment of the government to addressing all of those. And so we now know where more attention, more resources, as well as innovation is needed to ensure more effective and impactful action. And why is all of this important? This is important because when you have a healthy population, you have a healthy workforce. So when you have a healthy workforce, then the productive capacities in societies are enhanced, which has a direct implication on the economy. Most importantly also in terms of the decline in fertility rates, what it does help us recognize is the possibility for family savings. Because when the numbers are small, the parents are able to conserve their resources. They're able to invest better in the social well-being, in the health, in the education of their children. So you have better education children. And we saw from the statistics on teenage pregnancy the factor of education. So better educated children means a better qualified workforce that speaks to Rwanda's aspiration for upper middle income country by 2050. But when you have more family savings, what it does is that it creates the availability of resources in the system to finance the system for more domestic resource mobilization by government, which then contributes to government investment in the social sectors as well. So this is not just about health. It's actually about the socio-economic transformation of the society. And that's why this is absolutely important to us. So clearly, I want to say on behalf of the UN system and all my colleagues in our cooperation partners group, many are present here. So I want to affirm our commitment to aligning our resources and technical assistance with the priorities that have been identified through this data in pursuit of the SDGs. The UN, together with our bilateral and multilateral partners, will continue to support national efforts to strengthen data systems, invest in the health and social sectors, and promote equitable development for all citizens. Finally, allow me to affirm that the data presented today serves as a map for where the government needs to go to form a foundation upon which a more equitable, inclusive, and prosperous future can be built. And we see that in NST2 anyway. Now, what is remaining is for us to now line up behind NST2 in terms of the strategic priorities that government has identified and to help to accelerate the realization of all of those priorities. What this survey makes clear is that we all need to redouble our efforts. We need to accelerate progress towards the SDGs, but we now need to ensure that every woman, every child, and every family in Rwanda can live healthy, dignified, and fulfilled lives. Congratulations, NISR. Congratulations to the government of Rwanda. Thank you very much.
Thank you. Thank you so much, Mr. Ozonia, for those remarks. We all need to accelerate and double our efforts towards the achievement of the Sustainable Development Goals. Your remarks, as well as the success of this event, really speaks to the role and the power of partnership and collaboration in advancing not only Rwanda's health, but also the country's development agenda. We thank you. Now, the findings of the RDHS speak directly to the heart of Rwanda's health system, touching on maternal and child health, reproductive health, nutrition, as well as the population dynamics. It is now my honor to invite the guest of honor to the podium, the Honorable Minister of Health, Honorable Dr. Sabin Nsanzimana. Please, let's welcome him with a round of applause.
Good morning, Ngaramtse. Before I reflect on the findings, may I request that we stand up, we stretch the legs, and we celebrate some of these findings. Freestyle stretching, as you can. Thank you. Honorable Ministers, UN Resident Coordinator, DG NISR, distinguished partners, leaders, we have the governors, and also the mayor of the city of Kigali, who hosts most of us, and partners, civil society, colleagues from the health sector. So for us, we are receiving the findings from the National Institutes of Statistics, and it's time for us to reflect, use the data, improve our policies, our plans, and next time when they come back to measure what we're doing, we can see the trend even better. So I won't be long, just a few points, maybe 4 or 5 points, very brief. Number one is to appreciate the work done. The Minister of Finance has already mentioned it. On the 25th of February 2025, we met as a steering committee supporting DHS as usual. So we met at the National Institute of Statistics, and there were kind of hesitation and a bit of confusion of what we do. That's why just a few months that we learned that USAID is no longer supporting DHS. It was a significant contribution that we have had before. So the partners present here were around the table. We're just going through the numbers, the budget. Things were not coming together. There was a lot of gaps, but I recall the commitment from everyone that DHS should not stop because one of the partners is not putting in money. We still have the innovations that we can do things differently, keeping the standards and the quality, but making sure that DHS 2025 doesn't stop. So for most, it was the same. For others, they're saying, what if we postpone for next year? Maybe something will happen. We said, let's keep the calendar, let's keep the program, and the DG and NISR was committed that there is ways to do DHS within the means, and even more efficient and more precise. So today, we came back together to demonstrate that commitment was possible, and people come together. It's not about the amount of money. It's about how we are committed, and how we trust each other, how we aim for the same goals. So congratulations to everyone. Second, I looked at the numbers and the trends. The numbers look very interesting and good in many ways, maybe 90% positive. But there are three indicators that, to me, need more reflections and probably guiding our next planning and strategy as we start a new year. The teenage pregnancy that has increased, it's a very big problem that we need to address as partners, as a government, of course. And this one is linked to another indicator that is not going the way we want. It's very connected to that. This is neonatal mortality. You've seen only a 2% drop from 19 to 17. That, to me, it's not a positive trend. If you go into the deep statistics, you probably see that within the same confidence interval. So it's not a positive change. For us, it's an area of focus, and is linked to teenage pregnancy. If you go into the data we have within the sector, those young mothers who are 15, 16, 17, they are most likely to have maternal mortality, more neonatal mortality. And the third indicator that I want to connect to this is stunting. And again, these three are connected. It's actually one trend. It's one single set of indicators that are into one box. Teenage pregnancy, neonatal mortality, and stunting. These three are connected. For those who are in the sector, you may see how they are interlinked. So what NISR just presented to us is a confirmation of what we've been seeing from our day-to-day work within our sector. So what do? We have a plan, we are implementing, but we need to move faster and to be more creative and innovative. On teenage pregnancy, on neonatal mortality, on neonatal survival, and that will impact on stunting. From 33 to 27, it's 1% drop every year. It's not different from the past 10 years. It's not different. So, and our ambition is a drop of 3 per year, which means we need to increase our efforts 3 times. So we're already implementing a 2-year plan to address stunting, but with these numbers, we'll probably go back and rethink our plans, look for ways that work, digest the numbers, go into districts that are in red, in yellow, and then maintain those in green. So we didn't have the details, but they are coming. The DG mentioned the detailed report that is expected soon. So let's go deeper, digest the numbers, but draw actions that are going to save these lives, the neonates, but also those who survive neonatology, to live a health without stunting, because we all know complications of stunting. For other indicators, the trend is good, actually, more than expected, like access to services, 98%, we've clapped, but this is about quantity. This is about geographical access. So as a sector, we've moved to another step. It's not about access. It's now, how do they access it? At which standard? What are the quality? How many hours do they spend at the health centers when they come for services? Because getting there is one thing. What they receive, how they receive it, how long, how much. Those are the details we need to go deeper so that we don't just celebrate the numbers, but we take another commitment forward. To conclude, I want to say this is a 5-year survey. As a country that is advancing so fast in technology, in data, in artificial intelligence, in decentralization, in connectivity, we should think about how can we get this data even much faster. Imagine if these are coming in real time. And we're just seeing numbers for everyone who is coming in our facility. Every baby born in a community, and we see the number coming here, real time. Everyone dying, we see it real time. This is not a dream. It's happening. We just concluded, we launched a health intelligence center. For those who visited, that is just a small step of what we want to achieve as a government, that we should not wait for 5 years to have these findings. And this is what we're working on with the Ministry of Finance, with the NISR, with Ministry of Local Government, Ministry of Agriculture, all the ministries present and leadership and our partners, that with the current capacity and connectivity technology we have, we should not be doing the same we did 10, 20 years, 30 years. We can make a step forward. So next year, that is our main focus. We will work on those new ways of getting big data even faster, maybe more comprehensive and more detailed, without waiting for contribution of amount of money that may not be available when we need it most. But partnership works, and data is useful when it comes the right time. So that is my wish. Next time we see numbers flowing into our mobile phones, our dashboards, and this is a good trend, but we are aiming for something even bigger that we'll be discussing as we start 2026. So, Merry Christmas, Happy New Year, and let's continue this type of commitment. Murakoze cyane.
Thank you so much, Honorable Minister, for the festive wishes, but for also reinforcing the central message of today's dissemination. You have highlighted the government's commitment and also reaffirmed the importance of addressing persistent challenges, and we look forward to data being more accessible. We do appreciate your remarks. Now, before we transition to the next part of our program, we are going to take the official group photo for the dissemination of the RDHS7. I would like to request if photographers could kindly be on standby, and I'd like to invite our distinguished guests seated in the front row, if you could kindly come to the stage and honor us with this moment to have a group photo. You're welcome. If we could have, yes, please. You're very, very much welcome. We're very delighted to have you with us. And as we take this, for the second set of the group photo, I'll be inviting DHS partners as well as senior government officials present here. So we're going to start with this, and then right after, I would also like to request senior government officials present here, governors, mayors, please, you're welcome. If we could also have DHS partners, please come and join in in the photo. Thank you all. As you saw, this photo was a very important representation and record of today's event and the strong collaboration between government institutions. Thank you all. Thank you all. We are nearing the end of our program. We are almost there. We're almost at the end of today's program.